All right, some gastroenterology lab tests. We will do most of these in the med lab. So for now, just have a general idea of what we're talking about. You can analyze stomach contents, and you can look for blood in the stool, which is what the occult blood stands for. A cholecystograph. Chole is the med term for gallbladder, so that is a test to look at the gallbladder. This way you can tell if there's any kind of stones, obstruction, something that's blocking up the gallbladder. You can also do an ultrasound. The one that's pictured here is a barium swallow, which is essentially a dye that is swallowed or given as an enema, and then it will show up as a bright white on an x-ray. It does use radio activity imaging, so it is radioactive, so keep that in mind when we're doing these, so they don't do them for just anybody. All right, neurological exams, what we might be looking at is cognitive function, which means upper level functioning. So this can be done for pediatric patients who they think might be a little bit behind the curve. This can be done for elderly patients who might have dementia. They may check your cranial nerves to see if all the stuff coming off your brain is working. They will check to see if your reflexes are working. Does sensation work? Does general motor work inside of your body? One of the biggest tests for the nervous system is the EEG, which is electroencephalography, which is in the picture here. And this one will detect brain waves very similar to the EKG and sort of map them out on some paper so that we can see what's going on. You can certainly do all sorts of imaging, so you can look at angiography, right? Angio refers to blood vessels. Okay, so this is looking at the blood vessels of the brain. And CT scans would be for computed tomography. They're very similar to an MRI, only use X-ray technology. You can certainly do MRIs. The PET scans are the ones that you see that are bright and colorful. So though they do use a radioactive dye, and then it shows up different colors on the PET scan. Myelography is looking at the spinal cord, and of course the good old X-ray. Lumbar punctures are another option as well. They measure the cerebrospinal fluid. They can check for blood, for meningitis, so those are useful as well. An electromyography, so EMG, they actually use small needles and a small tool that looks a little bit like a stun gun over the nerves inside the body. When they put that little gun to your nerves, they will put a small electrical shock. It does feel like a little bit of an electrical shock. It will then measure the amount of electricity going back and forth to your spinal cord to see if the rates are normal. A biopsy, we've talked about biopsies with pretty much every chapter that there was. You can do a full open incision, so first full surgical procedure, or they use a very, very large diameter needle, place it through the skin and take the sample that way. You guys don't do any of the actual biopsies, but certainly you would prep, as per the sterile technique that we have talked about. Again, you can do x-rays, CTs. There are certain blood tests that we'll talk about in med lab and ultrasound to detect cancer. Common cancer treatments, surgery. Obviously, we want to physically remove any tumors to keep them from growing very large. But that only works if the tumor is relatively solid and in a place that we can do surgery. Radiation is very pinpoint, so they can actually pinpoint to a tumor something deep. Shoot radioactive waves at it, which will then damage those cells and hopefully kill off the cancer. Chemotherapy is given usually in an IV. This is very, very toxic. What it does is it kills all the bad cells, but it often kills many good cells, which is why we see things like hair loss, vomiting, digestive issues, skin that becomes a problem, low blood cell counts, because you can't kill one without really killing the other with chemotherapy. From a provider perspective, just realize that when you're handling this, they do have a lot of biohazard signs on the outside, so be very aware that you need to use a lot of PPE, when handling chemotherapy drugs. You do not want to get any on yourself. And orthopedics, of course, deals with the bones, the muscles, okay, and the body structure, the joints. Certainly they would inspect and palpate. They can do almost all of the diagnostic tests. So really from an MA perspective, it's to drape position, okay, and assist the doctor in anything that's needed. Again, an EMG might be used here, certain urine blood tests, your basic standard types of radiographic images, okay, are very common because x-rays are best to look at bone. Okay, so that is the best way to look at a bone is through the x-ray. Arthroscopic surgery is much more common. This way you can see the picture here. They actually just use tools and a camera, so we don't have to make a full incision. It usually leads to better healing time on these incisions and less infection just because of the fact that, we're not completely opening up a joint in order to do that. Joint replacement surgery is to really replace the whole joint. They do have to open up the joint in order to do this. They would physically saw through, okay, the ends of bones that have a lot of arthritis in them. And then they would replace them with metal alloys, okay, that fit together much better. And this way, okay, they would have a brand new joint. This is really done for your much older crowd. They tend not to want to do these until the age of 65, just because they may have to be repeated. All right, and that is the end of the chapter.